Hi everyone, my name is Said Mudabrizadi. Today we are going to discuss about the artificial intelligence, and we have got the guest with us, Dr. Mohammad Abu Zaid. Welcome to the Imaging Experts of Pakistan, and we are very thankful to you that you have given us your time. And definitely, we are going to discuss a lot of things today. So now we talk about the artificial intelligence. As you know, that artificial intelligence is expanding, and now in almost every application we have got the role of artificial intelligence. So what do you think that how it will affect the radiographer practice?
See, as you said, now the term artificial intelligence or artificial intelligence is used massively in everything, even in our daily life. When we are watching the TV, when we are driving the car, artificial intelligence is everywhere. In medicine, artificial intelligence, uh, I think they go beyond the expectation. When we found robots doing some surgeries, for example. Now, when it comes to the medical imaging, there is many applications. Before this word become massively used, is using the artificial intelligence. Uh, but now the term itself gives this application the resonance. For example, the image reconstruction, the CAD, uh, it's artificial intelligence. You give the data to the computer, you the input, and then you give the instructions, and then the computer will do the job for you. So we cannot put our head in the sand and then say that no, the artificial intelligence will not change our work. No, artificial intelligence will change everything. It will help the radiographer, for example, to select the appropriate exposure factor. You don't need even to select the exposure factor. You put the patient parameters. It will help with the exposure factor. All the image reconstruction will be by artificial intelligence done in no time. And, in general, in radiology, definitely artificial intelligence will work a lot in the image interpretation. We
So
like
this
it, we don't like it. It will work a lot in image interpretation. It's threatening the radiologist's job or it's not threatening the radiologist's job. This is something, this is a fact. We should accept it and we should think beyond the facts. For the radiographer, as we said, that it can help in communication, artificial intelligence, it can help in the workflow, shortening the time of the procedures, 3D image reconstructions, radiographic labeling, automation of the reconstructions, image fusions, reduction of the radiation dose. So all this will be the artificial intelligence will play a part. So we need the knowledge, and we need also to change the job description to integrate the artificial intelligence in the.
this is what I was about to ask, like how is going to assist the radiology work performance?
Yeah, definitely. As I said, it will change the radiology work practice. Yeah, and for example, now if you go to the research database in the last year, you will find many articles published about the role of the artificial intelligence in the diagnosis of the chest X-ray and CT scan of the chest. Uh, this is a need. It happened last year because of the high number of the chest X-ray, the high number of the CT scan produced for the chest X-ray for the COVID patient. You know that thousands of chest X-ray, thousands of CT scan of the chest, and it will be just to depend on the radiologist to do the task of the image reporting.
Mm.
It's consuming of the time, it's reducing the performance. Many articles, many programs, many softwares coming now on the media, on the internet, commercially available with evidence-based research that these applications are able to detect the COVID. And you just think now after the COVID, they will go out for example, the stroke, the brain, CT brain, and the MRI brain. This is the most common procedures now on the medical diagnostic imaging. So these changes will happen. We need to accept it. We need to adapt it ourselves, and we need to think about what's coming next.
So do you think it's going to help radiographers performing some task?
Again?
Do you think this is going to help videographer as well to performing some
Yes,
task as well? Yeah.
it will help. Definitely, it will help the radiographer. As I, for example, with all the artificial intelligence application, if you will take usually 5 minutes with the patient, you will take 3 minutes. So you have to adapt it yourself to do, for example, 10 patients per hour, not 5 patients per hour. So 10 patients per hour, that means more images need to be interpreted and to be evaluated. The image quality will be very high, and the program will help you to say this image is good or bad, not subjectively, because now most of the image evaluation is done subjectively. You know, we say that the density is good, the contrast is good, the resolution is not good, and then we have the debate. Everyone has his own opinion. Now with this application, with artificial intelligence, we can get to the result very fast, very quickly. So yes, it will change the radiographer work practice. Just remember a few years back, the darkroom technician. If you remember, when we have the darkroom, maybe you are in the young generation.
Yeah.
We have a darkroom. This darkroom is placed by, it has a place, it has equipment, it has personnel. This is completely finished now. It's not available anywhere. And it's available in some countries, but most of the countries now goes for the digital and the computed radiography. So yes, you will find that the number of tasks that is done by artificial intelligence is more. So the radiographer, he needs to have the knowledge to develop his artificial intelligence skills, not only the radiography skills.
Definitely. And what do you think that artificial intelligence, the role of artificial intelligence in the future of radiography?
The role, you know, you just compare it to that you are driving. I don't want to say a model of the car, but you are driving a 1994 car model, and then they give you 2021 model. So the role is completely different. The tools that artificial intelligence will help will provide to the radiography practice will definitely improve the work practice, performance. It will change the scope of radiographer, and I'm sure it will develop another way of advanced practice or another way of role extension. If we do another comparison, now most of the radiology practice, they don't do the skull X-rays. Forget about the skull X-rays. People in my age, they remember when we do the mastoid X-ray or optical nerve X-ray or inner ear X-ray. Now all these conventional procedures are no more. The things changes by computed tomography, MRI, ultrasound. So definitely we'll see something else in the future. We need to be prepared.
Okay, this artificial intelligence, do you think it's like is a threat to some jobs, and how this reflect in radiology practice?
It will be a threat to some jobs. Definitely, it will be a threat, especially if we keep still. We didn't move. Okay. Now, if anyone wants to establish a radiography department or radiology department, he need only one X-ray machine, and he need 2 CT scans, one for the general X-ray, general CT procedure, and one for the advanced CT procedure like the cardiac and bone measurement or 3D reconstructions. So it will be a threat, especially if we are not ready for that. We will find that some radiographers who are not able to work with a computer find it very difficult, and the radiographer who are not able to improve their IT skills, they will find it also very difficult. They will find themselves out of the market. Definitely it will be a threat, and definitely for the radiologists, it will be also a threat. So they need also to work hard to see how this artificial intelligence will help them to improve their work and their job.
Perfect. At the end, this is the format of our program that we ask our guests, like if you want to give any advice to our listener, and also if you want to share some grievance, like if you want to share through anything from this platform.
See, I usually say some words to my students. Change will happen, whether we accepted that or we don't accept. So we should be aware about the change, and we should accept changes. If we don't accept the changes, then we will spend a lot of our energy in the resisting, and at the end we will lose. So this is very important. We don't want to get fights with others. Our main task is providing the best healthcare quality to the patient, working in a team. So we don't want to be we don't want to lose our energies in something that will not get benefit to the profession. So how to success? We need to encourage the radiographers. Who is we? The universities, the societies, and the stakeholders, the Ministry of Health, for example, the health institutes. We need to have our own educational activities. I don't like when the radiographer go to the conference, or to a conference, a very big conference, and then at the end of the day, he found that most of the topic is not related to his area of interest. Okay, it's not about just go to conference or attend the workshop and get a certificate, keep it in your CV. No, the radiographer should be able to design their own scientific meetings, which will serve their education, and it will help them to communicate between each other. Now, of course, with the online, with the technology, we can meet, even we don't need to travel. We can meet and we can build a strong. One of the important things also, I also advise, participate. Don't always be listener. If there is any conference and you think that you can give 5 minutes in any topic, you are not confident about yourself, write the abstract and then seek help from any colleagues from the university, from seniors people, to polish it and make it good for this conference. Don't always be in the audience. Okay, this will help you to build the confidence, self-esteem, and definitely it will help not only you and your colleagues and your students in the future. It's a shared responsibility. It's your responsibility, it's my responsibility, it's everyone's responsibility. This is our profession. We have to like it, okay? If you don't like it, it's better to quit early. Don't put yourself after 15 or 20 years, then you discover that, oh, I don't like this profession. So you lost a lot of time. If you don't like it from the beginning, quit. If you like it, then you should fight to make it better and better. Thank you.
So thank you so much for your time, and it's an honor for us that to have you at our platform. And definitely, we have discussed a lot of things today, and this is going to benefit all the radiographers.